everyone, and welcome back to the series 5 in 5. In this video, I'll be discussing how to manage a patient who wants to stop smoking. What questions do you ask them to find out more about why and how they will stop smoking? What options are available to them? What support will they need from you as a clinician, but also from family and friends around them? If this is the first time you're watching one of these videos, or you are new to my channel, then my name is Dr. Baptiste and I currently work as a portfolio GP. I create videos to support you on your medical career journey. This series is a more clinically focused series of videos. As always, if you enjoyed this video, then be sure to give it a thumbs up, subscribe and share with those who may find it useful too. So let's start. You should start by checking the patient's existing knowledge. If the patient wants to stop smoking, you can ask them if they are aware of the options available. This helps you understand what they already know and therefore what you need to discuss with them and how much detail to go into. Some GP surgeries offer in-house smoking cessation services, but some surgeries direct patients to local services in the community. It is good to know about any previous attempts to stop smoking and what worked and what did not work for them at the time. You should encourage the patient to do the following. 1. Agree on a stop date. 2. Create a list of the reasons as to why they want to stop smoking, as this may help them with the motivation that they need to stop smoking. 3. Consider what situation or situations or people may trigger them to restart or have a relapse. Perhaps the patient may want to restart or start activities such as exercise, which may be a short-term or long-term substitute for stopping smoking. It is also important for the patient to set themselves targets and rewards. In terms of conservative management, the patient uses a local stop smoking service and or they motivate themselves in addition to support groups or a support network. Medical management. There is nicotine replacement therapy or NRT, which includes chewing gum, inhalers and nasal sprays as examples. A few things to know are: 1. Skin patches may exacerbate pre-existing skin conditions such as eczema or psoriasis. 2. It is not recommended for women who are pregnant or breastfeeding. 3. All pregnant women are offered testing using carbon monoxide detectors. If the patient is smoking or stopped less than 2 weeks ago, the carbon monoxide level will be 7 parts per million. They should then be referred to smoking cessation services. NICE also recommend that light or infrequent smokers should also be referred, even if they register a lower reading, for example 3. Current advice from NICE is also that pregnant women should stop smoking abruptly without the use of medication and referred as above. If they decline a referral, then NRT can be prescribed if they have not been successful without medication in the past. Just note that all nicotine replacement products are licensed for use in pregnant and breastfeeding women. The preference is to prescribe intermittent dose forms such as chewing gum and lozenges versus patches. Patches could be prescribed if the woman has significant pregnancy-related nausea and or vomiting. NRT may be continued for 3 months after the patient has completely stopped to reduce the chance that they will relapse. Side effects include things like nausea and vomiting, headaches and flu-like symptoms. Other forms of medical management include bupropion or Zyban and varenicline or Champix. Just a few words on these. Bupropion. This is an 8-week course. The patient starts it a week before their target date for stopping. Some side effects include things like dry mouth and insomnia. It is not to be used for patients who have a history of seizures. It should also not be used for patients who are experiencing symptoms of acute alcohol or benzodiazepine withdrawal. Varenicline, again, this is to be taken 1 week before the target date to stop smoking. Side effects include nausea, insomnia, and abnormal dreams. It is also known to cause mood changes and suicidal ideation. It should not be given to those who are under 18, pregnant, or breastfeeding. It should be used in combination with behavioral support or treatment. Of course, there are also e-cigarettes and vaping. As you may know, these are electrical devices that often contain nicotine, but many other substances. The evidence suggests that they are less harmful than normal cigarettes, and many people have stopped smoking by using these. However, they are not risk-free, the long-term effects are not known, and therefore cannot be deemed completely safe. They are not licensed medicines, but they are regulated by the Tobacco and Related Products Regulations 2016. The patient should be followed up regularly and supported on their journey. They should also be supported should they choose to reduce the amount that they smoke, and offered NRT2. Patients should be given enough medications to last for 2 weeks after the stop date. You can then prescribe 12 weeks of NRT or the other two methods. Lastly, you can also direct patients to the Smoke-Free National Helpline on 0300 123 1044. So that was a brief overview of the smoking cessation options and how you can support patients who want to stop smoking. If you enjoyed the video, then be sure to give it a thumbs up and subscribe if you haven't. I'll see you in the next one.